Professor, could you briefly describe your methodology?
I specialize in physical rehabilitation and restorative treatment. In essence, I work with energy processes, hemodynamics, neurodynamics, as well as biochemical and biophysical processes, everything involved in recovery. However, my primary entry point is through biophysical methods.
How does your approach differ from conventional medicine?
In about 99% of cases, state insurance-based medicine successfully solves patients' problems, but there is always that remaining 1%. When the system doesn't fully understand the condition, its logic, or its nuances, that's where an individualized, tailor-made approach becomes necessary. We adapt scientific knowledge to each patient and develop personalized treatment methods. We never replace state medicine. That's a strict principle. It operates on its own level. Instead, we complement and extend it. We work with patients for whom medication or surgery is unavailable, ineffective, or has led to complications. We also don't take emergency cases. Acute care is the highest level of modern medicine. And I come from that field myself. Our role is follow-up care, rehabilitation, recovery, strengthening the body, and enhancing its natural ability to heal and regenerate.
Who are your patients, and what issues do they come with?
We work with a wide range of patients, including children, from premature newborns to various pediatric cases. I even classify them as children of nature, children of cities, and children of medicine. Most of those who come to us fall into the latter two categories. These are children whose parents want them to become stronger, healthier, more athletic. We believe that even a child without obvious physical talent can be developed into a strong, athletic individual. Another group includes at-risk children, those with scoliosis, kyphosis, joint dysplasia, connective tissue disorders, and, in some cases, more serious conditions. As for adults, our specialty is severe orthopedic, neurological, spinal, brain, and joint injuries. We usually begin working with patients after emergency and surgical care has been completed, once there is no longer a threat to life. From that point, our focus is recovery. One of our key groups is active men and women over 40. People at this stage tend to fall into two categories. Those who feel their best years are behind them, and those who believe the best is still ahead. We help the former become the latter. We address a wide range of chronic and complex conditions. But success depends heavily on the patient's own motivation and involvement. And of course, athletes. Who is an athlete? Someone who invests their health in achieving results. Our goal is to help them perform more effectively, more impressively, and to extend their athletic careers. This includes injury prevention and high-level post-injury rehabilitation. High level means that when we restore an injured joint or limb, we aim to make it even stronger than it was before, stronger than its pre-injury state. This is essential to eliminate the psychological after-effects of injury. Our methods make this possible because everything we do is highly professional and strictly individualized. We often work with athletes in commercial sports, preparing them for a season or for a new performance breakthrough. We also rehabilitate amateur athletes, help them reach a higher level, and provide individualized training so they can enjoy their sport more. At the same time, a large part of our work involves professional athletes. Some come to us for what you could call a second career. We help eliminate the consequences of poor training practices, overload, incomplete rehabilitation, and psychological trauma. In a sense, we help renew them. These are experienced athletes who may be losing momentum, and we help them come back, returning to sports like tennis, basketball, and others.
How long does rehabilitation take?
It depends. If we're talking about an athlete who has already been considered beyond recovery, the process can take anywhere from 4 to 5 months, up to 6 to 8 months. Especially in severe cases involving complications or surgery. In such situations, we don't just restore the injured area. We rebuild the entire body and bring it back to full functional condition. In less complex cases, such as joint injuries, recovery typically takes between 2 and 8 weeks, depending on severity.
Do you guarantee treatment results?
There are 2 types of guarantees. One is a guarantee of continuous improvement, positive progress over time. The other is a guarantee of a specific final outcome. Take spinal injury patients, for example. Moving from bed to a wheelchair is one stage. From wheelchair to crutches is another. From crutches to a cane, another. And from a cane to a treadmill, yet another. When recovery can be broken down into clear stages like this, it becomes possible to talk about guarantees. If a patient has been walking without crutches for 10 months, that's essentially a point of no return. As long as they continue working on themselves, that's key.
Why did you choose to open your clinic in Spain?
We've always been sensitive to poor weather and environmental conditions. So we were looking for a place where recovery would be supported not only by our work, but also by the environment. Somewhere the view itself contributes to healing. I once worked in Santa Barbara, but it's far away. So I searched for this paradise on earth in Europe, first in Switzerland, then Italy and France, and eventually found it in Gibraltar, within Spain. It's a unique region with a special microclimate, mild enough that you don't need heating in winter or air conditioning in summer. So when people come here, they don't just receive rehabilitation. They also benefit from sunshine, fresh air, palm trees, great food, and proper rest. It becomes a complete recovery experience.